Hi, everyone. I'm Dr. Z. I'm a clinical psychologist specializing in transgender care. Welcome to my channel and welcome to Monday's Q&As. This is a place where I answer you direct and specific questions as long as they can be generalized to everybody else. So if you do have question that is direct and specific to me, feel free to email it to me at info@drzphd.com. The email is going to be in the description box. Having said that, as always, I keep your names and emails and everything else, any kind of personal information, completely anonymous for security and obviously privacy reasons. I always select randomly 6 questions that appear first in a queue of all of the questions I have in a folder. And we're going to go through all of them together. I have not seen or read the questions yet, so we'll see what pops up today. And there's going to be timestamps below if you want to jump around. Having said that, let's get started. First question for today. In a recent Q&A, you talked about the option of transition now being an actual decision, whereas it wasn't, say, 10, 15 years ago. It was an option 10, 15 years ago, but what I probably meant is that it is way more accessible today than it was 10 or 15 years ago. In addition, insurances are more likely to cover some elements of gender-affirming care here in US. The problem is that at age 48, my life is really good in every way, apart from gender dysphoria. So how do I make the decision to risk what I have for what I might have? I've got this far, surely I can manage another 20 odd years and therefore not emotionally subject my family and children to my transition. So this is a very personal question. It's a personal question in regards to what do? You 48 years old, you have family, you have kids, and you have a feeling that this is just maybe not even going to be worth it. If you have that feeling, I just want you to know I have a ton of clients reach out to me with the exact same feeling, asking me, is it going to be worth it? When it comes down to asking yourself whether it's going to be worth it, what you got to look at personally, from a personal vantage point, is to numerous factors. I'm not going to sit here and preach that everybody should transition, that if you're trans, you absolutely must transition, because the reality of life and circumstances and a lot of other things is not as such. So to consider whether it's worth it, what I personally do when I work with clients is I help them look at multitude of things. What is the nature of dysphoria right now? How debilitating, severe, how painful it is, how much is it affecting the quality of your life? Some people say, I barely feel dysphoria. I just know that I'm trans and I don't even know what transition is going to solve. Well, that's a completely different conversation than somebody saying that I go to sleep and I wake up thinking about how uncomfortable it is to live in my gender assigned at birth. Again, two different type of conversation. But it's a personal thing, and it's about really looking at multitude of things: your access to resources, your relationship to yourself, your desires, your wishes, your need for continuing to live your life in the way you've been living, or continue to live your life authentically. When people say I can manage another 20 years, I always tell people that you don't know. I don't know if you're going to be able to manage it for 20 years. What I usually assess for in terms of whether a person but what is the likelihood of them to be able to manage it for X amount of years, I ask, and I encourage you to ask yourself the same thing: have you observed gender dysphoria in terms of distress increasing as you get older? Sometimes people say you have to assess the severity. Has it gotten more severe? But not everybody feels it severely per se. Some people just say, I feel neutral about my body. So what we're assessing sometimes is, have you noticed yourself thinking about your gender more often? Have you noticed yourself ruminating about your gender more often? And that rumination, that constant increased thinking about your gender, that in of itself is already demonstrates an increase in terms of from where you're at in orientation and relationship to gender to where you're going. But nobody will have a crystal ball. Some people feel like they've been coping and they can cope until one day they realize they can't. It's a personal things. There's a lot of pros and cons. Like I always say, everything is going to carry a risk. Getting in a car and driving to work is going to carry a risk, and gender transition is going to carry out a risk, but it's also going to carry a benefits. And in this case, if this is truly who you are, we know that one of the benefits is going to be feeling more confident, feeling more assertive, feeling a decrease in gender dysphoria, feeling more comfortable with yourself, feeling joy and happiness for the first time in your life. I mean, the numerous benefits to it. But I also, like I said, I'm not going to preach to people that you have to transition. There also, for some people, believe it or not, there are people who feel like to them it is more beneficial to maintain the lifestyle versus going through gender transition. Completely personal things, personal decisions, personal choices. The best I can do is to be in a position, and hopefully if you're in therapy, the best your therapist can do is to help you look at everything in regards to gender dysphoria, and to assess all sorts of things and present them to you and say, hey, based on your psychology, based on your access to resources and circumstances and your dysphoria and your history of dysphoria, and how has it been changed or not throughout the history of dysphoria, here's what we have here. What do you think is going to be the best for you? And sometimes it's also nudging and challenging fears that you might have. That's usually what I do. Sometimes people have a fear such as, I'm afraid that nobody's going to be with me, that everybody's going to leave me. And if that's your fear of considering, of actually putting transition aside and your happiness aside because you're so afraid of that, then I will challenge that, because it's very clear you really want this over here, but this is what's blocking you. And so it's my job to massage and help you understand that your fears are not always realistic, and how to also help you learn how to handle and deal with those fears. So hopefully this is helpful. I apologize. I can't, I wish I could tell you, oh, you should definitely transition and you should definitely go for it. Your life is going to be so much more amazing for it, because the reality is that there are people I know who have gone through transition who do tell me that, hey, yeah, my dysphoria is alleviated. Yes, I do feel better, but can I say that my life is 100% improved? No, my life is just different. And that's also the reality of things. It's not all unicorns and rainbows on the other side, not for everybody. Everybody's circumstances in life is different. And for some people, being going through transition, and sometimes they do lose family and loved ones, and for them psychologically that's even much more damaging and more painful than living with dysphoria. So again, as you all know me, I'm very when it comes to the things, it's very personal and depends on many things. Best I can do is to help you to make your best decision, but I'm definitely not going to cheerlead you into anything. I would love to hear others to share with you some thoughts, some ideas. And by the way, 48 years old is, if you're ever wondering if that's too old, that is not old at all. So hopefully this helps, and I wish you all the best. Question number 2. Hi, Dr. Z. I have a question related to this video's question about Euphoria. So this must have been under the video for Euphoria. I do get some euphoria from my friends and family using my pronouns, but I'm still waiting to reach a point where strangers use them without me asking. I know passing isn't always possible, and breaking the societal gender binary is good, but there is that part of me waiting to get that validation without telling them first. I feel deep down that euphoria will be stronger, like it's different somehow. Do you think this is a healthy mindset? I love your channel so much. Thank you. You are so welcome. Do I think it's a healthy mindset to wait and seek and feel a need to have strangers gender you properly so you can get that validation and experience that euphoria? I would challenge you, and I would say that I wouldn't say that that's a healthy mindset, but I wouldn't necessarily say that that's an unhealthy mindset. What I would say is that it's natural desire to be seen as your authentic self by people who don't know you. It is a natural part of your evolution into yourself, to want to have strangers who don't even know you to immediately pick up on gender cues and know what your gender is and identify you as such. A lot of us seek that validation. A lot of you going through gender evolution are going to naturally get pulled towards the need for that validation. Now, of course, being constantly dependent on that validation and having that high expectation of that validation, that's where we fall into the trap of not the best mindset for it. It's okay to desire it. What's not okay is every time you step outside the door and you go somewhere, you wish for it. You almost hyper focused on it. You put that desire on the pedestal, and every stranger you meet, you're like, oh my God, are they going to gender me properly or not? And when they don't, it's probably very, very heartbreaking for you, and very painful to hear. So for that reason, this is why it's not the best mindset, because it just sets you up for, it's like building up these castles. What I ideally would encourage you to do is I would encourage for you to have the desire to be there, recognize that this is natural desire, and let go all the attachment and expectations of the desire, and know that you know who you are. And every day before you step outside your door, to exercise confidence and ownership of owning who you are, knowing who you are, anchor and root yourself in your identity. And a lot of times when you do that, what you'll notice is that you'll be much more confident. You'll be less anxious out and about because you'll be less looking for strangers to validate you. And people are going to sense that level of confidence, and things are going to fall into place. So that's what I would recommend. So again, not that it's unhealthy. Keep in mind, it is natural to seek that validation, but you just want to not put that on a pedestal and build it up so high. But fantastic question, and I wish you all the best. And I am sure that you will experience that euphoria with strangers, and I'm sure it's going to feel an amazing and fulfilling. And then before you know it, it's going to happen more frequently, and then before you know it, it might just be something that doesn't really matter to you anymore. Who knows? And then you'll be looking back at this question, you'll be thinking, huh, it doesn't even matter to me anymore. So, but I wish you all the best. Question number 3. My question for all therapists, including you, Dr. Z, is this: why are you so incredibly supportive of your patients and viewers? Okay, so let me read this question first. I already have an answer for this. Why do all therapists, including all of mine except one who wasn't a traditional therapist, she's shamanic priestess, ooh, I love that, helping me learn what it means to be a woman in our society, why do they all not push back in any way when it comes to having patient client talking about transitioning from one sex to another? And hopefully whoever asked is listening, because I did just push back on the first question. I did not cheerlead, but I said that it's a personal consideration and a lot of factors fall onto it. I may be a special case considering I have always been able to pass in transitioning at even an old age. I'd always known because of some of my most earliest memories as a 5-year-old dreaming of being a girl. I'm just really curious why that is. All the detransitioners claim no one challenged them either, and now they're left with terrible after effects. I have a new good friend. She has a male to female 15-year-old girl starting at a new high school after having living all abound because of state government stance here on transgender children. So it is that your friend had to move. That's really challenging, and hearts and families has to move. In terms of this question, why? So let me ask, this is, I feel like, two-part question. One, why? I'm going to speak for myself. Why am I so incredibly supportive of, let's start with my channel, of viewers on my channel? I'm incredibly supportive of the viewers of this channel because people need support. There's difference between support and there's difference between blind shepherding or blind cheerleading, or and if you who ask this question, if you're familiar with my channel content, you will quickly see that the way I deliver content, it tends to be as objective as possible. In other terms, I do not shy away from sharing warnings, to share challenges that people meet, to share that people need to think through, versus running into things, versus immediately jumping into transition. When I talk about people who are still questioning their gender identity, I always say, if you're still questioning, medical surgical is the last thing that needs to be on your mind. So, but that's educational. Support, we all need support. Support is basically showing up and saying, I hear you. I hear you. I hear that you're struggling. I hear that this is difficult for you. A lot of my comments to a lot of people is thanks for sharing. I wish you all the best. That's support. And we all need support. Whether people are right now trying to figure out if this is for them or not, or if they're truly transgender, there's still a place for support, especially right now. And support is so simple to give. Support is simple as opening up space and hearing somebody speak and being there for them. In terms of not pushing back, I would disagree, but I can only speak for myself. I had numerous of clients where, well, I wouldn't say numerous, that's, I think, overreaching it, but I had a few individuals, adults, I work only with adults, where it didn't appear to me, given the context they provided to me, that it was a gender issue attached to a root gender dysphoria, where it was other element at place. And I also had a very small percentage of individuals that were having very severe secondary mental health conditions, where it appeared on a surface where that it may seem like gender dysphoria, but it was not. And I never shy away to be as transparent and to say that, giving an information you provide to me right now, I don't think this is what it is. I feel like it's my job to be discerning. When I feel gender affirming therapy, I think the affirming for me in gender affirming therapy is to affirm that the truth you're telling me is your reality. But because I am a psychologist in this field, I feel that it is my part of my job description then to be discerning and help you understand where it comes from. And that's where discernment comes from. I think a lot of colleagues actually genuinely are the same way. I think it's, if somebody just comes and say, I want to start medical surgical, and therapist says, sure, let's get started. That doesn't even sound very, very mindful or reasonable. So I'm sorry if you came across providers, and I'm sure they're out there who are like, yeah, let's go. Of course, you got to transition. Your life will be so much happier. To me, that's a Pollyannish view. That's again, promising unicorns and rainbows. I think the best is to prepare a client. If this is what they want to do, the best is to discuss every little step on the way and to help them rally resources to get through it, because people do get through it, but also not to take away from the possibilities that transition does offer at the same time. So I think it's a balancing act. At least for me in this field, it is a balancing act. Sometimes I have clients who really want to transition, but they're holding themselves back. There's resistance, and that's when I push on them because I see that they really want it. Sometimes I have clients who I can just tell they're not even sure if this is going to change their life for the better. And that's not the time to push. That's the time to say, okay, let's make sure that no stone is uncovered. And let's see at least what we can do in the meantime to help you cope if dysphoria is distressing in a way where we're not bringing medical and surgical intervention. So it's a really, really good question you're asking. And I gotta say, I think also media tends to skew a lot of things, say that a lot of therapists are cheerleading people on. I don't think they are. A lot of my colleagues are really responsible. So, but anyways, I only can answer for myself. So hopefully I gave you answer for myself. And again, if you only see some segment of my content, you'll see that I'm very, and people on my viewers know me, that I'm very like, if this is going to be hard, it's going to be hard. If you're going to lose loved ones, yeah, you might lose loved ones. I say it how it is because you're all adults. I don't want to sugarcoat it to you. And the better informed you are, the better equipped you are to deal with whatever comes your way. But great question, and thank you for asking it. Question number 4. My question is, how feasible you think it is to do part-time social transition, coming out and presenting feminine at work only while largely largely continuing to present as a male in family life and the social life associated with family. So this is, can you only come out at work, but then personal life and social life, you're not out? I'm asking because I do not hear this commonly discussed, but I think it could fit my circumstances. It will allow me to protect my kids from bullying and my wife, who has deep abandonment issues aggravated by experiencing a lot of prejudice due to a toxic family, our interracial marriage, coming from country where girls perceived as easy. I am so sorry for that. Also, given my height, I stand out so much that psychologically it can wear me down to be out in the world and less accepting unpredictable environments presenting in a feminine manner. And I am then relieved to retreat to my male presentation just to feel safe and not be ogled. Hmm. So I'm not sure I would have the psychological strength to present full time. That's a very valid question. And by the way, if you're working with therapists, your therapist should be able to assess your psychological strengths, your ego strengths, all of those things, how likely you are to deal with challenges, and assess it not so much to tell you you can do it, you're not equipped, but to help you then build up and cultivate that strength. Because we do build that strength, it is buildable. I therefore wonder if it would not be best to just selectively present in specific environments and work may be quite safe. A large company in big US city with non-discrimination policy, and I'm financially sufficiently safe. In contrast, I fear that being out everywhere may cause my family and myself an excess of negative experiences. We have been hurt by friends to whom I came out in the past, and I fear this could tear my marriage apart and or lead me again to see repression of my trans feelings as the only option. Yeah, that could also happen. Depending, yeah. Let me finish and I'll speak to you. I would like to ask if you think that emotionally it could be too draining to commit to switching back and forth and between fitting into different gender boxes at work and elsewhere, or would it likely be perceived as silly by colleagues at work to do gender fluid social transition part-time only, where maybe I would also go to work as male some days after all. What is the experience with this? This is a really, really important question. You're not alone in asking this. I have, again, met numerous people who ask me to how they can play a partial game, whether it is at work or at home or somewhere else. And it's an important question when you are living in circumstances where you have family, kids, and you personally feel a lot of concern, a lot of worry, how it's going to affect kids and how it's going to affect your family. The first thing I want to say to that concern is I want to encourage you to really think about how and to what extent that concern is actually valid. I say this because for a lot of trans individuals, living a life from, especially the earliest age, experiencing gender dysphoria, there's a lot of self-loathing, there's a lot of guilt, there's a lot of shame that it's externalized as a result of living with dysphoria. And as a result, people tend to create internal schemas where they think that they're worthless or they're bad or they're not deserving of love unless they um, essentially really become um, sacrificial lambs, if you will, to people around them. And so people end up creating the schemas where, and I see this again and again, where they start catering to and start to really taking care of everybody around them and not taking care of themselves because they don't feel like they're worth it. Their sense of value has been stumped by self-loathing. And so as a result, you take care of everybody else. And by doing so, and you protecting everybody else, you start feeling actually better about yourself because it does make you feel better. But then that becomes like this strengthening breach without which you cannot live. So I encourage you to just challenge you to think about it for yourself, because families do survive, kids survive. I've seen gazillion kids and parents and wives and husbands and partners survive. People are very, very resilient. We're all much more resilient than we actually realize. Having said that, if you still carry such a tremendous sense of responsibility and guilt, and you feel like you absolutely cannot step into the decision that is best for you because you're so encompassed by the sense of responsibility for your family and for your kids, and now wondering, can I alleviate my distress by just coming out socially at work? That is an option. Partially coming out in one domain of your life while living your other domain in your life under gender assigned at birth presentation is an option. However, as a psychologist, I don't recommend doing it for a long period of time because you are creating a mental split. The analogy that I use is I definitely don't, but when gymnasts do a split with their legs, I hope you all get this analogy, and maybe some of you even get a laugh of me demonstrating this now. But imagine that one foot of your left leg is um, in this domain of your life, which is your work, where you're going to be presenting authentically, and your other leg is in this. Your other foot, your right foot, is in the domain of this life. And the more you go back and forth, you're tearing yourself apart. You're creating the split and maintaining this. Nobody can maintain this for a long time. This is strenuous. This is hard. So for that reason, long term, it's not suitable. I have seen people do this for short term as a way when they're starting to actually go through gender transition and they're not ready to come out here, they start over here. But the goal is always eventually to have this take over in all other domains of their lives. If this is not your goal, can you do this? Yes. Is it going to be hard? Yes. Is it going to start creating psychological split? Yes. What is the psychological split is going to look like? It's going to look like potentially in the beginning, it may feel like you actually decreasing dysphoria because you are presenting as your authentic self at work and people gender you properly and it feels good. But then as time goes on and you have to be over here and then you have to come back over here and your mind keeps jumping between the two, there's potential for dysphoria actually to exponentially increase. Because now you tasted this, and this becomes a reality of what's possible. And this becomes also a reality that is restraining the possibility of this happening. So again, I've seen it done short term. It works short term. Long term, I don't think it's sustainable personally. And my heart goes out to you because you are trying. I can feel it in your what you shared, how you're trying to find some things that will alleviate the suffering you feel. And I genuinely feel your concern for your family and kids and your partner, and already what your partner had to go through, and family and friends. And this is a tough one. This is tough. Usually in these cases, if I was working with you and you decided to transition, the way I would approach it first and foremost is to help you and your partner and your kids to build up a supportive system around you, is that is going to be there and is going to support you throughout the process versus maintaining a system that you feel like is going to fall apart. But long term, to the split is I would not advise it. Can you try and go for it? Absolutely. Who knows, maybe you will even get away with it and you will say, hey, Dr. Z, it works for me. I just haven't seen it work long term. But I wish you all the best. This is a tough question. My heart goes out for you. People are always trying to figure something. It's so hard. I feel like when you're living with dysphoria, and if it's really especially dysphoria that is eating at you, I feel like it's a quicksand, it's really sinks you in, and it's natural. I see people constantly trying to grab and pull. What can I just do this at work? Can I just start hormones? Maybe I can just secretly do this somewhere in privacy. It's grabbing to almost like all these options are little branches you're trying to grab onto so that you don't drown in a quicksand. And it breaks my heart because it's so painful to witness. But I also so understand that life and circumstances, another thing, do play a factor, because we're all humans. We all have hearts. We all have feelings. We all have responsibilities. We all have guilt and shame and other things. And not everybody is like, I'm done. I'm just going to do it. And I don't give a shit about anybody else in my family, or I'm just going to do it because it's time for me to think about me. Everybody of us differently. And there's no right and wrong. And people who do it, there's no right and wrong. There's just your way based on your psychology and your history. So wish you all the best. I really hope you're working with a therapist in your area. I think that can be really, really helpful for you. Just talking to somebody will be really, really helpful for you, because I feel so much tension in your message. I hope others will share and give you some feedback and support in the comment section. And I wish you all the best. Question number 5. Hi, Dr. Z. I'm born biologically male and have all characteristics, but since I was 3 years old, I knew I wasn't male like any other around me. I was 10 years old when I started to dress androgynous, and then after a few years, pushed it all away for trying to be a normal cisgender male. I struggled with this aspect of my life and not with being gay. I was proud to be gay, so I wasn't in the closet for that. I'm 51 years old now and have been living socially and dressing in my non-binary authentic way now, and the dysphoria has lifted a lot. That's fantastic to hear. I consider myself non-binary because I have a female aspect to myself in my gender. I do not want to push inside or deny. I'm very proud to feel this within me, so I do come across as an feminine, male-looking person. I have come to accept my inner transphobia and a feminine nature while looking primarily still masculine. I consider myself masculine slash femme and sometimes femme slash mask dressing. I still have dysphoria around my genitals and want GRS surgery, but not wanting to transition to become female at all. I have found that I'm proud of my body for what male characteristics I do have and like them very much. It's just having male genitals, I'm dysphoric and always have been since I was a small child. I always felt aligned more having a vagina and always wished I did and remain male looking dominantly. Is this a common situation you see in practice with non binary people you see? Yes, it is. Not only with non binary people, but it is a common situation where I had people, for example, who identify as trans female, trans women, and they don't really want to, whatever their circumstances are, they don't want to go through hormones or transition, but they do want to have genital surgery only to alleviate their genital distress. This is common. And having vaginoplasty, if that's going to alleviate the distress, you even bolded it in bold. It seems like it is something that you're trying to emphasize here because it is giving you distress. That's okay to do. For non-binary individuals, it is, I feel, because we live in society where there's still not enough cues, I feel like a lot of people are still trying to find themselves. And I feel like a lot of people are still also trying to find themselves not only in their presentation, but also in their relationship to their body. Um, and so, is this something that I see? Yes. Have I seen people have surgery while presenting male looking dominantly? Yes. Is it fine to do that? Yes, it is fine to do that. Some people will say, no, you either trans feminine or trans masculine, and if you're getting vaginoplasty, you're trans feminine and you need to go all the way. I always, me, I call it out as a bullshit. That is not true. If it's giving you distress and it's debilitating, it's really making you uncomfortable and struggle, and you feel like surgery can help, then surgery maybe can help. Yeah, it's not that uncommon. So hopefully this is helpful for you and others, people who are non-binary listening to this, who may feel particular certain way about having genital dysphoria. Perhaps you feel comfortable, share below, but it is quite common too. Great question. Question number 6. Hello, Dr. Z. I have a question. I have already been on my hormones, male to female, for 30 months. I'm 55 years old. 30 months, that puts us what? Almost 3 years, right? Am I right? Yeah, almost 3 years. I'm 55 years old, and I understand that the changes I want have not been as expected. Sad emoji. I'll just say something about that too. But I have obtained several of the changes, such as breath, soft skin, and mentally calm happiness. As a woman, my hair, a disaster because I lose a lot of weight, but I'm happy above all things. But I really changed a lot more physically. Can I be more passable as a woman when I go out on the street? Please allude to understanding more about my change. I've been with your channel since you had 11K subscribers. Today you already have 29K. Congratulations. Thank you. Arrow, I have not lost weight. Okay, so you have not lost weight. Okay. So first of all, thank you so much. And thank you for being a subscriber from, sounds like almost pretty much the beginning of the channel. I really appreciate your support. 3 years, almost 3 years on feminine hormones, you're 55 years old, and you feel like you already got all the changes you have expected. I would challenge you on that. So hormones are really, really fascinating. And especially the more I work with clients, and then I help clients go through transition or create a transition roadmap or whatever it is. And it's fascinating because I've been very, very fortunate where clients I worked with will reach out years and years after transition because something is happening with their life and they appreciate my direct kind of no nonsense approach and they want to kind of tune in for a session or two. And so it's amazing because I get to really witness their life and the changes that they went through. So I have seen a lot of people 50 plus who I worked with, and then they come back and I'm like, whoa, whoa, all of this amazing changes suddenly took place. Hormones work in a really fascinating way. And there's no particular set of predictability with them because each body is going to metabolize and respond to hormone differently. And it's also going to be highly dependent on your genetics and your health and a lot of other factors going to go into it. On top of that, some people have had a lot of masculinizing effects from testosterone prior. Some people had lesser. All of those are also going to play a factor in it. Lastly, one of the most important things about hormones that I have experienced, and again, I'm not a medical doctor, do check in with your medical doctor, but this is what I have observed, and some of you have heard me speak about it on this channel, is that it's really interesting when you have been on hormones through, for example, oral administration, and after several years you switch to injections, or from when you go from injection to pellets, or vice versa. In other words, when you shift and change a route of administration, it's really interesting. Suddenly, your body is almost kickstarts because it's receiving hormones through different means, and it's suddenly a lot of people have reported, I witnessed sudden changes that they were not expecting. So if you have been taking hormones for 3 years through one particular method of administration, talk to your medical doctor and see if they're willing to switch it up. For trans feminine individuals, progesterone becomes really, really important. I wrote a blog about it on my website. There's a medical um, peer-reviewed article by a doctor that is linked to it, where she talks about the importance of progesterone for trans women. Progesterone additionally enhances breast growth. It does additional physical changes, and also it's really great for your mood. So that's another thing. I don't know. You have to realize, and I really want everybody listening to this realize, transgender medicine is still baby in the United States. When I say baby, I don't mean that doctors don't know what the heck they're doing, because there's a lot of doctors who know exactly what the heck they're doing. But what I'm saying is that we had kind of like transgender tipping point, if you will, where there was a lot more transgender awareness. As a result, a lot more people became aware. As a result, a lot of people suddenly understood what was going on. So a lot of doctors who have never treated trans individuals suddenly got flooded with patients, and they had to offer endocrinology, that's not how you pronounce it, endocrinite, cronine. You know what I mean? Had to provide the hormonal gender affirming care and learn as they go along. So it's a baby for some doctors in that respect. So on top of that, a lot of doctors are using the old dogmatic things they have learned or read somewhere, which is patient comes in, you put them on oral estradiol and you put them on spironolactone and you monitor levels here and there. A lot of times they don't even know how to adequately look at the blood level. So what I'm saying is there's a lot of doctors who may not do very specialized approach, just like in therapy, right? You don't see that many YouTube. I don't know. Perhaps there is other therapists out there who are solely focused, like Dara Hoffman is a therapist who also focuses on trans and non-binary folks. But you don't really see that many therapists who just only focus on this population because it's still kind of I'd say because of the boom in infancy. So you have to challenge your doctors. You have to do your research. You have to kind of get a better understanding. There is now a lot of papers written. There's a lot of medical documentation out there that documents effects of all of the things, effects of progesterone, for example. It's okay to print out that article and bring it to your doctor and say, hey, I saw this article. Look, it is a medically peer-reviewed study that says that this is good for trans women. Can we try this? Advocacy for your stuff is going to be really important. So what I'm trying to say is that 3 years, I wouldn't say, I would hesitate to quickly say you have experienced all the change you can possibly can, because that would not be true. Because I've seen people continue to experience changes after 3 years and after 5 years and after 6 years. And anybody listening to this who has experienced it will comment and let you know that is true. What, I would recommend is when you say, can I be more passable as a woman when I go out in the street? As I always say, passability, for those of you for whom passability matters, passability is another interesting thing, in my opinion. I know that for a lot of trans folks, when they think passing, they think I have to be able to just immediately look 100% feminine. And when they think 100% feminine, a lot of very hyper feminine features come to mind. Very symmetrically beautiful face, large breasts, very curvy body, very the stereotypically hyper feminine features. The reality is that there's a shitload of cis women that don't have those features, that are athletically built and stocky and don't have that hourglass, are more straight shaped, have smaller breasts, or don't have symmetrical facial features, have even facial hair. So what really we need to realize is that might be something you think about when you tie to passability, but you need to realize that it's really not about achieving this hyper feminine stereotype. It's more about having enough feminine, if passing as you go, feminine markers, that when they're all lined up for a brain, a person who is observing you, it is enough markers where for them, the brain tilts to the feminine and they go, oh, it's a woman I'm looking at, because that's how the brain works. Our brains are very binary still. And when we look at a person, our brain subconsciously immediately scans automatically without us being aware of it. And then quickly we go, oh, hello, sir or ma'am, for those who use pronouns and gender people. So it's having enough markers. I cannot tell you how many trans women I've seen with what one would say masculine voice and what one would say a not symmetrical face or stocky body build or whatnot. But when they have enough of those markers, and usually it's a combination of things, of the combination of the presentation, the clothing, hair, gestures, it could be little things that sometimes add up. They get gendered and they have no problem passing. So that's really important to realize for anybody who care about passing, is that for a lot of people, and I see this a lot because I work with a lot of clients, and when they tell me my goal is to pass, I ask them, what does it mean your goal is to pass? And they say, well, my goal is to pass. Usually it is, if I can wake up and not even do makeup, I go out there and people see me as a woman. And then I say even further, well, okay, you without makeup, tell me a little bit more about the features and characteristics and physicality you presume to be passable. And that's when people say this beautiful face and this curvy body that's undeniably feminine. And that's, it's just not reality. It's not reality of women. We come in all different shapes and sizes, tall and short and voluptuous and not voluptuous. It's all we're all very different. So I would encourage for you to challenge yourself to think about that. And perhaps you're just really hyper focusing on this like ideal of passing. Keep going. Look, you said that you are have this mental calm. All of these changes make you really, really happy. That's wonderful. Obviously, things have improved in your life. 30 months, 3 years. It's really not that. And again, I don't know what your regimen is. I don't know what kind of, for example, spironolactone or Spiro for sure, that is dogmatically prescribed across the board to everybody, has been also documented to actually stifle some feminine changes. So there's a lot of things at play here. Don't give up and keep going, and things are going to start. Sometimes things suddenly start popping like popcorn. You just kind of push over the tipping point and suddenly you see all these changes. And other people will comment below and they will let you know that they have been on hormones and they're still experiencing changes, and it's been longer than 3 years. But great question. And again, thank you for being subscriber for a long time. And I wish you all the best. These are all fantastic questions. Thank you, everybody who has asked questions. If you have a question for me, you can email it to me, email to info@drzphd.com. It is in the description box, and I'd be happy to put in a folder queue, and then I snatch them based on the orders they come in, 6 at a time. And I'm always very, very happy to engage in a dialogue and shed some kind of light and understanding on things all of you are struggling with. Having said that, comment below. Always love reading all of your comments, and I wish you all a great day. Bye.